Assalamu alaikum. Good day, everyone. My title is The Deadly Cycle in Gaza, which is composed of three components: the AMR, the malnutrition, and the infectious diseases. I am Abdul Raouf Al-Maname, a PhD in microbiology from the Islamic University of Gaza and currently living in Gaza. The content of this presentation is an introduction about the Gaza and how it became an environment for infectious disease. We will focus on the core concept, which is the vicious cycle of malnutrition, infectious disease, and AMR. We will focus also on malnutrition in Gaza, infectious disease surge in war conditions, and the antimicrobial resistance, which is sometimes called the silent accelerator, but it is no longer silent really accelerator, because its role became obvious. Also, we have to analyze some cases in Gaza Strip. Also, we will be talking about how to break the cycle through integrated interventions, and in the conclusion, we have to call for actions. Gaza Strip is a very small, narrow strip, because the total area is 365 kilometers. But after the war, it was narrowed down to about 50% by occupying the whole North Gaza and Rafah, which is in the south of Gaza, and a very large strip, making the 2.2 million people are concentrated in a less than 50% of the area of Gaza Strip. Very highly populated area. In fact, 97% of the water was contaminated even before the war, and we have a chronic health system strain due to siege and restriction on importing and bringing in equipment and materials. In the current war conditions, near total collapse of the WASH infrastructures, healthcare, maybe less than 15% capacity, the mass displacement of 2.2 million people internally in Gaza Strip, several times, many of them maybe more than 15 times were displaced from one place to another place. The scientific reality, which is a very harsh reality, that pathogens thrive in these conditions and human immunity also collapses. The key indicator is the case fatality rate, or what is known CFR, from infectious disease has increased 3 to 5 times since the onset of the current hostility, and this is reported by the WHO. This is the core cycle, which is composed, as we said, malnutrition, and this conference is about malnutrition and famine. Malnutrition usually weaken the immune system and increase susceptibility to infections. And once the people are infected, they need antibiotics. Also, the inappropriate use of antibiotic due to the health system collapse leads to the antimicrobial resistance, which is the third component in this cycle. Infection with an antimicrobial resistance leads to greater malnutrition because of the poor absorption of nutrients due to the infection conditions, prolonged hospital stays, more amputations due to untreatable wound infection, and of course it will lead to more deaths. This is also again will lead to increased malnutrition. So this cycle continues. Even the killing by bombs and airplanes has stopped. They will still continue to kill people in Gaza Strip. With more details, we can speak about malnutrition, the immunological foundation of malnutrition, current status, UN reports, March 2024. Of course, the situation has aggravated after that, 90% of the population experiencing acute food shortage or insecurity, 30% plus of children below 2 years acutely malnourished, 15% severely wasted. The micronutrient collapse in taking the form of iron, vitamin A, zinc, and B12 deficiency is very common. Of course, the immunological impact, I know that there will be a lecture presentation about the microbiome and the health of the human. Malnutrition, of course, will influence the microbiome. Microbiome is the total number of microbes present in and on the human body. One of the most important part of the human microbiome is the intestinal microbiome, which when healthy can protect the human health and increase immunity by coaching the immune system, by tightening the junction of the cells, so no leakage from the intestinal content to the other parts of the body. While malnutrition will cause disruption of this normal process by the microbiome, thus causing several problems. Mucosal barrier breakdown, which is very important in fighting infection, immunodeficiency in the form of reduced CD4 cells, T cells, also impaired neutrophil function, and hypo-responsive vaccination, meaning that the response to vaccine is lower. Also, cytokines dysregulation was proved that malnutrition will cause such event. Gaza-specific factors, we have also, in addition to malnutrition, we have stress-induced hypermetabolism from a constant trauma, which exacerbate catabolism in malnourished people. The infectious disease surge, we can also look at it from a different point of view. We have the microbes, we have the host, we have the environment. When we speak about the host, the human, the malnourished human in the Gaza Strip, while the agents and the environments are also a very important factor, because the agents are there and the environment is very suitable for the propagation and transmission for this agent to a susceptible host. So it is really a perfect environment for infectious disease spread and transmission in the Gaza Strip. Documented outbreaks, diarrheal diseases over 200,000, and when I say these numbers are usually the estimation is lower than the actual value because of underreporting of such cases. More than 200 cases, 2,000 cases, 50% below 5 years. Of course, the case fatality rate about 20 times the baseline before the war. Respiratory infection, leading cause of death in children, skin disease, scabies, lice, also very common in Gaza Strip, hepatitis A and meningitis, re-emerging with waterborne spread. Key factors, routine vaccination collapsed. I'm not saying that it is totally collapsed. However, there were obstacles. The coverage, which was almost 99% and sometimes 100% before the war, has dropped to 89 and maybe below 89%, which led also to the appearance of the polio case in 2024. AMR or antimicrobial resistance is an accelerator for this cycle because first it make infection difficult to treat, so it prolonged the transmissibility of the pathogen from the infected people to other people due to its resistance to antimicrobials. However, we have to put in mind a few points that really very important in this issue. Empiric treatment dominance, no lab results. So all physicians usually dispense or prescribe antibiotic based on previous experience or empirical treatment which might not be suitable for their patients. So we have a lot of antibiotics that are prescribed without culture results. Drug shortages, inconsistent supply, wound management crisis because of the multiple and nature of the inflicted wounds in Gaza, which is very severe, multiple and deep wounds, which requires a lot of invasive procedures. These invasive procedures increases the need for antimicrobials, I mean antibiotics. Thus, the resistance can flourish in the hospitals dealing with such patients. Crowding and transmission, resistant clone usually spread easily in shelters because of the overcrowding. Even in hospitals which were very crowded, not only with patients, but also with internally displaced people. Expected result, the resistance profile, this expectation is based on similar situation in different countries like Syria, and also based on a study that was published in the Lancet this year, last year, 2025, which showed very high percentage of multiple drug resistant, like the Escherichia coli and Klebsiella, high SBIL, SBIL is extended spectrum beta lactamases, and carbamazepine resistance, Acinetobacter baumannii, which is in many cases was pan-drug resistant, meaning that it is resistant for all antibiotics available, at least in Gaza Strip. Staphylococcus aureus, especially the MRSA or methicillin-resistant Staphylococcus aureus. The consequences: these drugs usually last line, like the carbamazepine before. It is now like the first line drugs, and unfortunately, in many cases, physicians were not able to treat patient because the resistance was total and pan drug resistance. Projected case fatality rates in this cycle in cases were malnourished. I think the diagram, the blue bars versus the orange bar. The blue bar is before the war baseline, and the current estimated CFR after the war. One of the factors is again the environment and malnourishment. There is an increase in the CFR either in childhood pneumonia, acute watery diarrhea, and war wound infection, and this increase is very huge and really should be considered as a killer that no longer can be stopped if we don't stop the conditions that created this killer. Since it is a cycle, we usually in medicine tend to break such cycles. We have three components that we have to improve in order to break the cycle. We have to focus on nutrition, ready to use therapeutic food, and multiple micronutrient powders. Infection control, we have to chlorinate water for drinking and for domestic use. Also work tracking at scales. Safe excreta management, so the waste also should be managed properly, either the wastewater or the solid waste. It should be managed in a way to prevent its let's say effect on the public. Wound care kits should be also entered into Gaza in abundance in order to deal with the many cases of injuries in the Gaza Strip. Antibiotic stewardship, even in amidst health collapse, should be thought of as a very important variable, a game changer variable in antimicrobial resistance in order to break the cycle that we have talked about. With the interventions, mid-term or medium-term interventions, which between 6 to 24 months, we have to restore the diagnostic capacity of all hospitals and laboratories of the country, re-establish primary care like vaccination catch-up campaigns like the measles and polio and pneumococcus, regular anthropometric screening for malnutrition, very important issue. AMR containment, formal antibiogram development, infection prevention and control. We have to train people even in makeshift clinics. One Health approach, which is a very vital view and approach to manage such multifaceted problem and multitask issue. Finally, we get to the recommendations for humanitarian actors. We have to integrate nutrition health program must be co-located, meaning that they should be nearby. Measure AMR in a method to include database and network to monitor the AMR emergence and levels in the Gaza Strip. Also, we have to advocate for medical supply consistency. Interrupted antibiotic supply cost life. For the health clusters and World Health Organization, we suggest that they establish Gaza-specific treatment guidelines based on local resistance reality because of the changes that have been monitored by some researchers in the Gaza Strip. And we have to create a rapid diagnostic supply chain for key pathogens that are either on the spread, they are present now, or expected to be present in such similar situation. Also, we have to implement centralized but secure electronic health record to track the cycle. For reconstruction planners, build back with WASH resilience. So we have to put in mind when we are rebuilding that WASH facilities should be integrated in planning rebuilding. Also decentralize health capacity. Many small units are safer than one large hospital, and that was really has been shown in this war. When one hospital was destroyed, especially the large ones, or occupied or attacked, many lives were lost in 1 week or in 1 month or during that period. So it is really very vital to think of many small units instead of one large hospital. Also, we have to include AMR labs in early reconstruct. It is a security priority for breaking the cycle. In summary, Gaza represent most extreme convergence of AMR, malnutrition, and infection drivers ever documented in the modern history. The cycle is already operating with child mortality data showing its deadly signature. And it is really a reality, unfortunately, overlooked often. Without targeted intervention, this cycle will become the dominant cause of civilian mortality long after active hostilities ends. Also, the breaking the cycle requires simultaneous integrated actions on nutrition, infection prevention, and antibiotic stewardship even amid active conflict. So these points are really very vital and should be considered in this issue. The overall message of this presentation to the world, to the whole world: if you can stop this cycle in Gaza, it will be a lesson for future conflicts and a testament to the power of integrated public health science. Thank you very much for your being there, and for the organizer again. These are the sources that I have relied on this presentation. Thank you so much again. Assalamu alaikum.